New guidelines tonight on when you should get screened for colon cancer. Instead of waiting until 50 years old, new recommendations suggest that people should get checked at age 45. Joining us tonight to talk about this is Dr. Dana Hayden. She is the Division Chief of Colon and Rectal Surgery at Rush University Medical Center in Chicago. Appreciate your time tonight here on News Nation. I think first of all, we know in part that these new guidelines were prompted by cases of younger people being diagnosed with colon cancer on the rise. Why is that? What do we know?
So we don't know too much about why these rates are increasing. However, what we do know is that for patients that are over 50 who do undergo screening, their rates are going down, not only of cases, but also of death. For younger patients under 50, we know these rates are actually going up, and we're not exactly sure why. There are some studies that show that it could be related to poor diet or sedentary lifestyle. And it also could be based on some tumor biology too. So there's a lot of research that's going on right now to see if there's maybe a different subtype of tumor that's happening in younger people. But what we do know is the rates are increasing. So there's been a huge push across the United States to lower the screening age to 45.
And really fascinating. We said earlier today in our report that of 1,000 people who were screened, they could essentially diagnose 50 people and save 25 lives. So it shows some evidence of how critical this is for younger people. Just to be clear, people getting screened, these are people without any symptoms. These are healthy people that should get screened at 45?
Correct. So there's two different ways we talk about colonoscopies or other screening methods. One is if a patient has no symptoms at all, and that's what we're talking about here. So that's actually what screening means. And it doesn't necessarily mean it has to be a colonoscopy. There's a bunch of different methods we have that can be used to do screening. Now, if someone is younger and is having symptoms like rectal bleeding or changes in bowel habits or unexplained weight loss or shortness of breath, then that person should actually get a colonoscopy, and we should not wait till age 45. That should be done at any time that a patient develops those symptoms, well younger than 45 at times.
Dr. Hayden, Chadwick Boseman, of course, the actor, died last year at 43 years old. Such a high-profile death to colon cancer, and many people's reaction was he was so young, and we didn't even know that he was suffering from this disease. How will his death push more young people to understand the severity of colon cancer and to go get screened early?
So what was horrible but also important about Chadwick Boseman's death was that not only did it raise a light to the increased number of cases for younger people, but it also raised light specifically in the African American community. So Black patients are more likely to get colon cancer. They're more likely to get it at a more advanced stage, and they're more likely to die from it than all other races and ethnicities in our country. So it was really important to shed a light, particularly in this community, to make sure we're talking about colorectal cancer screening, and also to raise awareness about symptoms, because there is a stigma associated with talking about either your different symptoms that are related maybe to your bowel habits, or taking control of your health and getting screened and bring it up to your family members or physicians. So there is some reluctance, and really in all communities, to do it, but specifically we need to address the underserved populations in this country, because the rates are even higher, especially in those populations.
Critically important, and I appreciate you mentioning that. So before I let you go, there are a lot of people out there who may see this and go, okay, well, I need to get screened, but I have some concerns. I have some hesitations. Colonoscopies don't sound all that pleasant, but you're saying it's important. So what can you tell people who may be wary about the experience, what they can expect?
Okay, so usually these procedures are done under sedation. So very rarely do people have any sort of discomfort during these procedures. Also, people are maybe worried about the bowel prep, which sounds a little bit aggressive, but actually it's pretty tolerable. And really the risks associated with colonoscopies are quite small. It is a procedure, it is invasive, but what's great about a colonoscopy is not only will it be able to diagnose anything going on, not necessarily just the cancer, but if there is a polyp or even a large polyp or early cancer, with just a procedure during the colonoscopy, we can actually treat that polyp, remove it, or even cure very early colon cancer. So it's both diagnostic and also therapeutic. So it's really important and also quite efficient, actually. So
yeah, and it can save lives. So get your screening, prioritize it now at 45 years old. So drink the Kool-Aid. You might not love it, but it'll be...
It might not taste that great, but it's definitely Kool-Aid that's important.
We wish it was Kool-Aid. Dr. Dana Hayden, appreciate your time tonight. Thank you.
You're welcome. Thanks.